Take the world's poorest people in remote tropical places with little to no healthcare and add disease. What do you get? Neglected tropical diseases, also known as NTDs. Why are people with these diseases neglected? Pharmaceutical companies are less interested in creating new drugs for the poor as it is not profitable, and governments have not done enough to tackle the problem. What is the perfect recipe for success? Increased support for national health teams tackling NTDs in their own countries, and simple new tests and treatments which can be safely and easily used. Neglect can be overcome, and millions of people saved.
So this week's topic is neglected tropical diseases, or NTDs for short. Chris Bayer and his colleagues published a paper in The Lancet called Neglected Diseases, Civil Conflicts, and the Right to Health, which I think highlights a number of important concepts for this week. So in order to illustrate some of the opportunities and challenges in treating NTDs, I'll start off by explaining the generic life cycle of a soil-transmitted helminth.
Soil-transmitted helminths are spread through open defecation. The eggs are transmitted from the feces into the soil, where the eggs hatch and can begin to grow. Weeks after someone has defecated in the soil, helminths can be transmitted directly through the skin if an individual is barefoot, or can be transmitted through contaminated water sources or the consumption of unwashed fruits and vegetables. The worms then mature in the patient's lungs and travel to the patient's gut, where they can produce over 200,000 eggs per day. And then the cycle repeats itself. Now moving backwards through the cycle, there are many points at which this life cycle can be interrupted. First, individuals infected with helminths can be treated with antihelminthics. A single dose can kill the worms living in the host, but it doesn't prevent reinfection. Secondly, transmission mechanisms can be controlled. Wearing proper footwear can prevent direct transmission into the skin, while access to clean water and proper washing of foods can prevent transmission as well. Third, there may be methods to control soil-transmitted helminths by mass treating the soil, though this would likely have detrimental effects on the environment and is not widely used. Finally, through a combination of education and access to sewage facilities, open defecation can be avoided, preventing the helminth eggs from entering the soil and stopping the helminth life cycle.
So as you saw, sometimes solutions for the prevention and management of NTDs are quite simple, or they may at least appear simple on the surface. On the other hand, sometimes they're very complex and require collaboration between a number of different sectors. Let's take the example of a single-dose treatment with anti-worm medication. Even though a single dose can effectively treat and eradicate the worms in a single individual, access to medication could be a problem, and reinfections will continue if upstream factors are not controlled for. So unlike malaria, HIV/AIDS, and tuberculosis, which do not discriminate and can impact an entire population, NTDs burden the poorest of the poor. As such, pharmaceutical companies have little financial incentives to invest resources into treating NTDs. Conflict and war zones can present unique challenges in treating and preventing NTDs, as demonstrated in the case of Colombia. Guerrilla forces engage in illegal activities such as kidnapping and production, trafficking, and exportation of cocaine, which now accounts for upwards of 3% of Colombia's total GDP. As a result, governments have invested resources in the military in order to reduce the impact of violence, but consequently have made cuts to public health expenditures. One of the entities impacted by these budget cuts was the national body responsible for controlling vector-borne illness. As a result, responsibility was decentralized to regional governments, and vector-borne illnesses like Chagas have become much more problematic. One interesting organization discussed in Bayer's article was One World Health, which is a non-profit pharmaceutical company dedicated to researching novel drugs for treating neglected diseases. This is an interesting example of how public and private sectors can come together to begin tackling the multifaceted problems in treating and preventing neglected tropical diseases. I think we will require more partnerships like this in the future. Stay tuned for next week when we'll talk about the surgical burden of disease following a lecture by Dr. Cameron.